Hey, hello everyone, and welcome to New England Hymns webinar series. Today will be presented by premier sponsor BARR Advisory. Today's webinar, Creating Cyber Resilience, Your Guide to Healthcare Vendor Risk Management, will be presented by Steve Ryan. Steve Ryan is a senior manager and head of healthcare services at BARR Advisory. With extensive experience in cybersecurity for healthcare, Steve collaborates closely with organizations to safeguard against cyber threats. His expertise spans risk assessments and audits under frameworks such as HITRUST, NIST SP 800-53, HIPAA, ISO, and SOC 2. Couple housekeeping items for today's webinar. A survey will be sent out to the group following today's webinar, including a section you can use to ask any questions that you did not get answered during today's session. An email following this webinar will also be sent out to everyone with instructions on how to claim your CP HIMSS credits. And we will also be posting a recording of today's webinar to our New England HIMSS YouTube channel. And then we'll also post that link to all of our socials so you can watch. Lastly, I'm going to ask you can use the Q&A feature at the bottom of your screen to ask any questions you have for the presenter, and then we'll save time at the end too in case you have any questions towards the end. So with all of that out of the way, let me introduce Steve Ryan. Oh, I'm so sorry, Steve. It looks like you're not muted. Unmuted, I should say. There we go.
There we go. Now we got it. Well, thank you very much, Julie, and welcome everybody, and thank you all for attending here today. So, as Julie mentioned, my name is Steve Ryan. I'm the head of healthcare services over here at BARR Advisory. A little background on BARR Advisory. We're a cybersecurity and compliance firm, really serving the highly regulated industries, finance, tech, healthcare, government, etc. there. But today's focus is really going to hone in on vendor risk management and how it's a key part of cyber resilience. Um, in healthcare, especially, vendor management is often overlooked, but it's incredibly critical in protecting your patient data, operations, and just general safety as well. So as we get into it here, again, just kind of a little bit more background about me. So again, I work specifically with healthcare organizations. Since I joined the workforce, I've really been focused in on healthcare as a whole. And vendor risk has been the topic of discussion, certainly as of late, but really throughout my entire career. As Julie introduced, I specialize in SOC 1, SOC 2, ISO, HIPAA, and HITRUST amongst the other frameworks and all the acronyms out there as well. I've been at BARR specifically for about 3.5 years, almost 4 years now, actually. And prior to BARR, I was at Wolf and Company, a large regional firm based out of Boston, Massachusetts, doing the exact same thing. But enough about BARR, enough about me. Let's get into what you guys are kind of here to cover today. So overall, we're going to talk through what is vendor risk management. We're going to talk through the vendor risk review process, tools in the frameworks, AI and vendor risk management, because how can we have a webinar these days without talking about AI? Vendor incident response, as well as creating cyber resilience as a whole. So at the end of the day, right, the goal is to help give you guys insight into how you can improve your vendor risk program immediately. And we're going to really focus in on the risk portion of that. But as pieces of this, we're going to talk through just the general idea of, hey, when do I even know when I need to have a vendor? All the way off to offboarding, because there are risks all throughout that process as well. So, kind of to throw some scare tactics at you right off the bat here, based off of the 2025 Verizon data breach investigations report, 1/3 of data breaches involve a third party, which is actually twice as much as the year prior. And that was in 2024. And prior to that, it doubled again. So this is a trend that we're seeing expand very, very rapidly, and why today's agenda and webinar is so important to have a conversation about it and provide that additional information where we can. So, just to talk through some case studies and some real life examples of, again, why vendor management and vendor risk management is so important. I want to provide over about 3 case studies here to give some additional background context on this as a whole. So, first off, we have back in 2021, December of 2021, we had eye care leaders. So, there was a ransomware on eye care leaders. If you're not familiar with them, they are an EMR platform for eye care practices. About 3.7 million patient records were affected, which was by far the largest breach in healthcare of 2021. Ultimately, eight healthcare providers had to notify patients of this breach, and we're looking at a little about 4.1 million in settlements being paid. So quite a bit of money out there that need to be paid out, and the true extent of that breach is actually unknown. Attackers have deleted databases and system configuration files, and unknown what they accessed before they actually deleted it as well. The next one here is one touch point. So, or OTP. This is a third-party mailing and printing vendor that is also serving healthcare organizations. April of 2022, they discovered their systems had been illegally accessed. More than 3 dozen healthcare providers, and this included Kaiser, Anthem, Blue Cross, all said their data was compromised as part of this breach. More than 2.6 million individuals were affected. The data compromised as part of this included names, addresses, patient medical records, employee information, so it hit both sides of it. And there are still incredible amounts of class action lawsuits pending. So we can't even really put a number on that breach just yet, and it's still 3 years later there. And then finally, how could I talk about case studies without throwing out Change Healthcare? Everybody's very familiar with this one, so I won't go into too much depth. But again, $2.9 billion in total breach cost. Just an incredible amount of money being spent on these breaches out there. In something that we really want to hone in on and really help out because your organization could be doing everything right, right? But because of these third parties and these additional attack vectors, you could be doing everything right, but ultimately maybe your vendor isn't, and they have an open pathway in theory into your environment as a whole. So just one more stat here, just to really call us out and hone in on this. More than 40% of third-party breaches actually affected healthcare organizations. Third parties, using third parties, especially in healthcare, is such a, I don't want to call it easy way to do this, but such a valuable way for attackers to get through this, just because of there's high value patient data, as we all know. There's constant need to access to that data. So there's always open channels, open ports, open whatever you want to call it, right? And there is just so much reliance on third-party vendors, and the interoperability between systems, organizations, and people that it's very easy for someone to say, hey, I want to attack this hospital, but I know they work with this vendor. Well, I might as well go through there because it's probably a better avenue for us to attack than it is to go right for the big fish, if you would. So again, all kind of background information for why I wanted to have this webinar today and talk through vendor risk management as a whole, and to ensure that we can best assist and provide some guidance where we can as we go through this conversation here today. So, what is vendor risk management? So, really, at the end of the day, the goal of vendor risk management is to identify and mitigate cybersecurity, reputational, and operational risks introduced by third-party vendors. Third parties exist everywhere, especially in healthcare, right? You have your EHRs, your cloud service providers, your co-locations, if you want to include them as well, telehealth platforms, payment processing, especially in gift shops, if you're a hospital yourself, HR and payroll software. The list goes on and on, right? Um, Vendors are just flat out a key piece of how you're doing business. You're not just protecting operations at this point in the hospital setting, right? You're protecting patient data, medical devices, and life-saving services. It's not the same as when, you may lose some money if it's a bank, right? You're talking about people's lives at the end of the day, which is again why we want to make sure we're looking at risk in as well-rounded an avenue as we can to make sure that we're honing in on those. And again, providing the best reasonable assurance to our patients, our customers, our business partners that we're doing everything we can. Again, just to beat a dead horse here, it's more than an IT issue. It is a patient safety issue at the end of the day. Through a structured and really methodical approach to vendor risk management, you're able to implement those appropriate controls that complement what the vendors are already doing, really beef up your security posture, maintain that operational resilience, and give your patients the best care that you can in the most secure manner and trusted manner overall, that you want to provide to them, of course. So, what are those key risks posed by third parties? Again, I've said it a couple times already, but they are and can be a direct link into your environment, right? If one of your vendors has a vulnerability or suffers a breach, it can very quickly become an open and direct line into your environment, right? But we also have to think about this. Yes, there's cybersecurity threats out there, the data breaches, the ransomware, um, all the scary stuff that is in cybersecurity these days. But now we also have to think about compliance risk. Are they meeting the HIPAA requirements and other regulations, especially all the new privacy regulations coming out that you need to be meeting? If you're sending your data there, how are you making sure that they have the right compliance in place? Are there any operational risks we have to consider? Again, everybody's moving to the cloud. Um, what happens if a zone or a region goes down? We've seen it happen before. Are you still able to provide that backup plan, disaster recovery plan to keep your hospital up and running if you need to? What happens if they go bankrupt? Do you have those additional backup plans and contingency plans in place for this as well? Financial risk, right? Um, Obviously, costs associated with data breaches we just talked about, penalties, legal settlements, or just fraud. Again, another vendor, another piece of the puzzle into there. And all kind of feeding up into this last one with reputational damages, right? At the end of the day, if a vendor mishandles your EPHI or your patient's EPHI, yeah, we can blame the vendor, right? But ultimately, what did you do right or what did you do wrong? Is it going to limit that trust that that patient has in you? And are they going to continue to go back to you, for time after time? So, as we all know, we're all in this space, right? Trust is so paramount in our healthcare space. Vendor risk management is just a piece of that puzzle in providing trust to your customers and or to your patients, to your business partners and key stakeholders. And it's about maintaining that trust and building that long-term operational resilience to continuously provide that support and care to your patients as a whole. So another stat I wanted to pull out from the DBIR is where are these breaches coming from? Software vulnerabilities, right? Now that could be in just general vulnerability management. That could also be in code management, right? That's a key system. It is 81% of all the breaches with third party, inclusive of third parties, right? It's an easy vector for attackers to get into the system. And if they are having a system intrusion on their end, and that is part of the source code or the code that's deployed in the SaaS product that you have or that you are leveraging, it's very easy for them to navigate to that channel and get into your environment from there. Again, social engineering and some of the other ones are a little bit easier to defend against at the end of the day if it's one party removed, we'll call it. But ultimately, with vulnerabilities being such a huge aspect of breaches, we really want to hone in and make sure they have the proper vulnerability management practices. They're doing their vuln scans, they're doing their penetration testings, right? And they're doing just general cleanup of their environment and they have secure coding practices. When we are assessing vendors, right, we don't want to just look at, hey, we know that name. They're a great name out there. Because I can promise you there are certain vendors out there, if you read through their SOC 2 report or their ISO report, there are some eye-opening and scary exceptions that they may have, right? We want to dive in deep to those types of reports and we want to look at how they're handling security as a whole. How are they looking at vulnerabilities, right? At the end of the day, vendor flaws are supply chain issues. If a vendor introduces a major flaw, it's just like a supplier sending you a faulty med device or a faulty prescription, if you would, right? We're able to hold them accountable for that, and we need to be able to, push back when something's going awry. Um, so let's get into actual vendor management and the process as a whole, right? So this is all the way through identification to step five, mitigation, ongoing monitoring. There is, you could call it step six, which is vendor offboarding, which I'll hit on briefly as well. But we really want to talk through, when do we even know we need to have a vendor, right? Can we do this internally? There's a new project or there's a new process. Can we build this internally? Can we reduce risk that way first off? Or no, we absolutely need to have a vendor to help come in and do this. What are they going to do to support? What type of access may they need? What are we actually giving them access to, right? Is this just a software vendor that's, a new startup? Is this a telehealth partner? Who are we actually working with and what are they actually going to be doing for us? That is kind of the first conversations you all should be having with leadership, your vendor management team, of creating that request, if you would, of, hey, I need a third party vendor. Here's what I need them to do, and here should be their scope of the work. They don't have to have the keys of the kingdom, as much as most of those vendors will tell you they need to do, right? But ultimately, what do we need to give them and what do we need to accomplish that we can't do ourselves? And what is that risk that we may pose to our customers, our patients, our business partners, etc. So once we've identified a couple of vendors, we identified that need, we identified a handful of vendors that make sense, right? We want to really hone in and who has the best bang for their buck for us. And I'm not talking straight up cost wise by any means. I'm much more talking about from a security posture, right? Everybody out there these days, they have a SOC 2 report or they have a HITRUST certification or they have X, Y, and Z, right? What is that report actually covering? Is it covering what we needed to cover, or is it covering something else out there that isn't actually in scope for what we're doing? So as part of that, and when you want to hone in and realize that one vendor that we want to go through the rows with, that's kind of how you can start leveraging that, aside from all the generalized items such as cost, reputation, who knows somebody, right? All those various factors. We also want to keep into account security as part of that additional identification process of that as well. Initial risk assessment, right? Again, doubling down now, we've picked a vendor, we want to really assess them. And one and two can really go hand in hand at the same time to help, narrow down and get into tier number three here, or process number three. We want to have that initial risk assessment and we want to be able to say, again, what access are they going to claim that they need? What is their inherent risk to us? And then what are some of these controls that we need to put in place on our end to make sure they're not providing undue risk to our environment? Um, Once we do that, we'll spit out a residual risk, and I'll get into this process a little bit deeper here in a moment. But then we're going to get into a tier assignment. Are they our most critical vendor, or are they staples? They're just providing us office supplies, right? They're not really all that important to us. If they were to be breached, it'd probably be a headache. Or where do they fall within that sliding scale? Because it is certainly a sliding scale, right? And that's going to help us determine what is that work that needs to be done on the initial assessments that we need to look at, but also that ongoing monitoring and due diligence process of this. Again, four and five kind of go hand in hand because you have your initial due diligence, but you also have ongoing due diligence. The work is not done once we onboard a customer or a vendor by any means, right? We need to constantly check in on them, make sure um, they're performing what they need to do as expected, but they're also still meeting the security requirements that we set forth from day one. Um, Again, I can't stress enough. It is a long-term partnership with your vendors that needs to go back and forth, and we need to build that trust upon for building out our security practice as a whole. So this is a little bit of a heightened or a detailed risk register, I'll call it. You have your level one vendors, your critical vendors, right? If you're on a cloud, if you're a SaaS startup and you're on the cloud, AWS, Azure, what have you, is probably your tier one, level one vendors. If they go down, you're in a big world of trouble, right? Versus again, it goes all the way down to your non-essential vendors, your staples, your janitorial staff, right? People that come in and help out and make your life easier, but they're not helping deliver a core service or a core product. Um, Again, this is a sliding scale, right? Maybe this year this vendor is a risk vendor, and maybe next year, actually, no, they go down to a level three vendor. This is one way to look at this. There are a number of different ways to look at your vendors. Again, these are levels driven. There's risk rankings such as critical, high, moderate, low. All to say is we need to bucket these vendors and organize these vendors. Because if we have a risk-based tiering process, it provides clarity in our vendor management process. How often are we going to be reviewing these vendors? Level ones? Probably certainly annually, if not more frequently, right? Level fives, maybe we're reviewing them once and that's really it because we're not changing what we're doing. Again, and it's a sliding scale and it depends on what your business is and who you're interacting with. And really you want to consider things like how sensitive is the data that they're accessing? How critical are the services they provide? How integrated is the vendor to your environment, right? A low risk vendor doesn't really support those core business functions. They have zero access to anything internally. Your customer data, again, your staples is the best example of that. Your high risk vendors, they are incredibly deeply embedded in your operations. It's your EHRs, your CSPs, right? They have access, or they could have access to sensitive data. They certainly have the ability and needs to stand up your critical services through their infrastructure setups, right? Where do they fall, and how does that determine what you need to be doing, right, for each one of these? So let's talk about that a little bit further. So, vendor risk review process. Again, you want to ask yourself questions. What is this company doing for us? What systems or data can they access? If they were breached tomorrow, what would the impact be, right? During your onboarding and risk assessment, what role do they play with you? What data do they have? What services do they provide? And how integrated are those services? These are all going to really spin up, as you saw a couple slides back, the identification of the right vendor for you and their initial or inherent risk to your organization as a whole. It is incredibly important for us to have these conversations, not just with the vendor, but with other people in the business, right? Of course, your leadership team, you want to have them involved, but you also want to bring in, middle management as well, or other key control owners or stakeholders. Maybe we're implementing a new configuration management process, right? We're switching platforms. Is this going to affect you? How are we going to be doing this? What controls do you have in place right now that we need to have? And can we ask them to have in place? It's incredibly important to understand the impact of each third-party vendor as you begin to identify them, but also begin to onboard them as well. And what we'll see in this next slide here is there's really three big phases to this. Again, I can't hone in enough on the risk assessments. It's been in almost every one of my slides that I presented so far. Um, we need to do that risk assessment, and that includes requesting documentation from that vendor. Prove it to me that you're saying what you're supposed to be doing. Do we have, as our organization, a security questionnaire that all companies need to answer? If the answer is no, maybe we need to start looking into that, right? If the answer is yes, okay, great, let's send it out to them. But do they also have any type of compliance attestations or certifications that can help provide us a little bit more reasonable assurance that they're doing what they need to be doing, right? Do they have a SOC 2? Do they have an ISO 27001? Do they have one of the levels of high trust out there? Do they have anything to show their HIPAA compliance, right? Most of you on this call, and certainly most of us in the healthcare industry, need to be doing some level of compliance. You guys are getting your SOC 2s, your high trust, your ISOs. If you're doing that, why are your vendors not doing that? Or why are we not asking if your vendors are doing that, right? It is so incredibly important to figure out the baseline of where your vendors exist before they even touch our system, because we don't want them to say, yeah, we're good. And all of a sudden they are truly a wide open vector into your environment. Um, so again, that's really how you're going to be able to help identify what level of risk is this vendor, what additional controls do they have in place, and maybe they don't have any. What is their residual risk? Based off that residual risk, is this a vendor I really want to work with? Maybe, maybe not. If it is someone we want to work with and they still have a pretty high residual risk that we're not really happy about with our risk appetite, maybe it's time to work with them and have some roadmaps or do some deep or additional security reviews. Perform an audit over them if you need to, right? Dive in deep, make sure that they are at a level of risk that's well within your company's risk appetite so that you know that they have the proper controls in place. And again, can provide that ongoing trust to your patients that data is safe with us and is safe with our partners as well. Now, again, that is phase one, and that's the hardest part, certainly. We need to figure out what are these risk assessments or what are these risks posing to us from an organization. But now we need to talk about due diligence, right? Great. We know that they're a high risk vendor to us. All right, great. We'll see them, when our contract's up. Absolutely not. We need to really dig into the details of reports. We need to dive in deep on, again, depending on your company's culture, but an at least annual basis for those critical vendors, and I argue potentially sooner than that as well. What controls do these vendors have in place? Let's actually look at those SOC 2 reports. Let's actually look at the ISO certification. Let's look at the high trust report. What exceptions do they have in place? Are there any qualified opinions in that SOC 2? Do they actually achieve high trust certification? Do they actually have a major nonconformity in their ISO cert that they finally fixed it, but it took them 8 months to fix, right? Are there any open issues ongoing? Are there any remediation notes that we need to look at? How are they doing what they're supposed to be doing, right? The other big piece of that is, especially in the SOC 2 world or even the high trust world or ISO world, there are responsibilities as us as vendors or customers of their product that we need to have in place, controls wise. Are they asking us to have X, Y, and Z in place? How are we, do we actually have that in place? How are we mapping that back to what we need to be doing, right? As for clarification, the vendor management process can be a bear, to say the least, right? How are we actually making sure that they're doing what they need to be doing if we don't ask those questions? Make sure that those customer user entity responsibilities are appropriate or they actually make sense. This also goes into play when we're developing business associate agreements or BAAs, right? How are we drawing the line in the sand of who's responsible for what? Especially, and this is a precursor to something else I want to speak about a little bit later on with incident management or breach notification, right? Is this all documented or is this something we need to work on together as we go through this process? And finally, you really, as part of due diligence, watch out for those red flags, right? It's easy to say, but we would really need to hone in and figure this out and look at it, right? Is the documentation actually valid? Yeah, they have a SOC 2 report, but it's from 5 years ago. Is that really helpful for us? No, not so much, right? Or their HITRA certification has lapsed. That's a huge red flag as well. Um, what is the actual scope of that audit? Again, I alluded to it previously, but is the scope actually covering what our product is? Read through that SOC 2 report. I guarantee you it'd be very interesting to see if it's actually up to what you think they're actually providing or certifying against for high trust or testing against for SOC 2. Um, your security questionnaires, right? Maybe they don't have a SOC 2, high trust, ISO, etc. And you send them a security questionnaire, but they provide very vague answers in that. They're checking that box, right? As much as I hate to say that, but they're not actually telling you what they're doing. Or they're saying, yep, we have it in place through these very high level things. All right, let's dig in a little bit deeper. Let's double click on that and say, hey, is this actually what we should be doing in the environment? Um, One thing that we want to definitely get into now is ongoing monitoring. You know, how often are we actually reviewing or re-reviewing these vendors? And that again is depending upon the risk that they are posing to you all. Best rule of thumb, critical vendors, every 6 to 12 months, you're re-reviewing their environment, re-reviewing their security controls, security posture. Moderate vendors, I would say annually, but you can get away with every 2 years, again, depending upon what they're doing for you and what services they're providing and what data they're taking in. Low risk vendors, again, that's call it user choice. It can really be determined upon what they're doing and what risk they pose to you all. It can be as frequently as, every 2 years, every 3 years, or it could just be upon contract renewal, right? Risk definitely evolves as vendors, adds new features. They change leadership. They're merging or getting acquired, right? Or they acquired somebody else. Are we in the privy to know that information of when they're adding new features? Are they providing us, release notes or any press releases around that? Are we still comfortable with those additional features? And maybe if it's material enough, now it's time that we reevaluate those vendors as a whole as well. Um, Changing leadership. If they just fire their CISO and they don't really have a security function anymore, yeah, their SOC report from last year looks great, but do we still have that same trust that it's going to be carried out the same way or the same processes are in place? Are we going to be aware of when they're getting merged or they're merging or they're acquiring somebody or getting acquired? Obviously, that's much more for the legal people to figure out versus us on the vendor management team. But again, important information to know as well as part of this process because that could severely change up the leadership and the culture of the company from a security first mindset to maybe security is just a burden that we have to do and check the box on. So again, we want to continue to have that ongoing partnership and back and forth with our vendors, with our customers, or and our business partners out there. We want to make sure that those vendors are also still, they want to maintain and improve their security postures over time. We want to make sure that they have plans. They're constantly getting a new certification or new attestation for doing SOC. Again, most of these auditing functions are either point in time or previous. They don't sell the future. Obviously, nobody can get into the future, but it's incredibly important to consider that as well of where they're going as we continue to grow and partner with those clients and customers or vendors. So again, it's not about mistrust at the end of the day, right? As much as it's coming from a we need to do X, Y, and Z or else something bad's going to happen, it's not that. It's really just having a conversation that we want to trust you. We want to provide trust to our or to our customers and our, key business partners. So we want to partner with you and we want to make sure we're on the same page. Again, vendor relationships should be built on transparency, accountability, and a shared commitment to risk management. And assess your role on that. Are you and the vendor meeting SLAs or control responsibilities? Are all expectations clearly documented and tracked? How do you know you're not missing the mark on something if you don't constantly have that documented or constantly are reviewing that, right? So a question poses of, again, I kind of alluded to it, how often should we really be having these conversations with our vendors? It all goes back to your risk assessment and the risk-based process to this. Critical risk vendors, maybe you're meeting with your CRM from AWS once a month, right? Having these conversations with them. Your lower risk vendors, maybe not so much, right? We should really be reevaluating that as frequently as we need to have that residual risk within our risk appetite. One thing I also want to talk through is, part of that ongoing monitoring of vendor management is sometimes some companies will only do it for, December. That's when we review all of our vendors, right? That is not the best practice because a SOC 2 report could come out in January and now we're waiting 12 months to actually review that report. As far as you're concerned, that could be unqualified and that could have a major exception that would question why you would even working with them. So again, best practice is to find out when their reports are due, right? Or the certifications are up and make that marker and review that in as real time as you possibly can so you have that best information out there. Again, if there is a material change to your environment or the or the vendor's environment as well, it's time for us to re-review and make sure we're still doing what we need to be doing on our end. We're still implementing the same controls that the vendor requires of us, but also at the same time, that vendor still makes sense for us to have and from a security standpoint, and we haven't missed the mark in any way, shape, or form. So again, vendors are partnerships. It should not just be, hey, we're buying a product from you. Great. Fantastic. It should really be working together from both the vendor management team from your organization with their customer success and security team on the vendor side of things to have that ongoing conversation, to have that mutual accountability to prevent gaps and misalignments at the end of the day. Um, so again, that's kind of the high, quick hitter level, if you would, on vendor review process from identification all the way through to the ongoing monitoring. Before I go into, let's dive in deep to some of those tools and frameworks we can use. I definitely want to talk about vendor offboarding as well. Vendors who we offboard still pose risk to us. Are they deleting out data? Or is our data or potentially our patient's EPHI still living within there, right? After we're terminated a contract. What are those rules and requirements that are listed out in contracts and MSAs that you have with the vendors? These are things that all should be talked about during the identification stage because that vendor could be your lifetime partner of 50 years, right? Or they could be horrible. And after 1 week, you need to terminate that contract. It is incredibly important to have a out with that vendor. And that goes through again, what risks do they have? What data do they have? And what are the expectations if the contract is terminated of what happens to that data? What happens to any IP or intellectual property that that vendor may have from you all? And what does that look like? Again, it should follow the same process we've already been talking about from that risk-based process. And at the same time, again, talking through what needs to happen for that with that vendor there. So let's dive into some tools and frameworks that are out there. So again, these are all avenues and aspects that we can go down to help assist us with identifying or not identifying, but risk assessing, performing due diligence and performing ongoing monitoring over these vendors. Questions to ask yourself as you go through this process are how are you currently tracking your vendors? Do you know when their audit periods are up or when their updated reports are available? Are you flagging any kind of gaps in the reports or are you just filing them away? Are you documenting those responsibilities they expect out of you? To help with this, there are tools available to streamline this process. There are plenty of automation tools out there. There are plenty of vendors out there that will help with vendor management as a whole, but it's incredibly important to be organized with your vendors to know who falls in what category, when those reports are up, and when I need to be reviewing those reports. So help making sure your risk tolerance is what it needs to be for each one of those vendors, and you're always up to date with their security posture, and things aren't falling by the wayside. So what I like to do is just walk through a couple of these examples of how, HIPAA, SOC 2, ISO, and HITRUST can help evaluate and support your vendor due diligence and monitoring strategy. I won't spend a lot of time on them because they're sometimes can be boring, but I want to make sure everyone's aware of what we're talking about here and how they can best help us through this process. The first one, everybody knows HIPAA, right? It's a key standard in the healthcare space. It really helps drive business associate agreements. It's incredibly important from us from a compliance standpoint that these vendors have the proper requirements in place and controls in place to meet the HIPAA security rule or the privacy rule or whatever additional HIPAA requirement we need to be following here. So, as we all know, I'm sure, finally HIPAA is getting an update for the first time in over a decade. Um, HIPAA is now removing required and addressable. Everything's required now. Um, you must either implement that requirement or you must have a documented reasonable alternative to that. And what HIPAA is going to do now is it's going to level the playing field a little bit. It's going to force the vendors and customers on the both sides to have a more solid framework out there where it's not as easy now just to throw a HIPAA sticker on your website, which please don't do for other reasons. But it's not going to be as easy anymore for them to throw a HIPAA sticker on the website. I will say the changes are great. It's nice to see the changes. It's still not enough, right? And we don't even know when this is actually going to go live and when it's going to get through, the government, if you would. We really want to use HIPAA security rule as something that's a good foundation or know what we need to tie back to. But there certainly are better frameworks out there and control types out there that can better help perform and meet requirements of HIPAA while also providing security for your organization through that vendor there. So let's talk about them, right? We have the SOC 2 report. This is probably the most common report in the US right now. It is from the AICPA and it's based off of up to 5 different AICPA trust service criteria, such as security, availability, confidentiality, processing integrity, and privacy. It provides a CPA's opinion over the design and effectiveness of operational controls. And that is one of the key pieces there. Because BARR is a CPA firm, in our opinion, could be very different than KPMG, who's also a CPA firm. And we can also help or navigate how that controls design or effectiveness very differently than each other. It is incredibly important to have a report that's from a reputable vendor. We're talking your vendor's vendor at this point, right? Is that a trustworthy source? Is that a not so great source that's out there who they're just providing over a SOC 2 report because they checked off a couple of boxes, right? I can't stress enough that SOC 2 is a great framework out there when it's done correctly. But we are seeing the industry SOC 2 reports not being done correctly, and it is causing a lot of havoc where the SOC 2 can no longer be a checkbox. We need to spend additional time and resources in reviewing that SOC 2 to make sure that those reports are appropriate. They actually cover the scope we need. Their controls actually make sense, and that SOC 2 is performed by somebody that is of credibility, which again goes back to it is a CPA's opinion. It is not a certification, it's an attestation saying that it can be done. Um, Again, as much as I would knock SOC 2 if you would, there are very, very good and strong SOC 2 reports out there, and they're very attainable for organizations to get, certainly that are in the startup space, where they're lower cost than some of the other certifications, or yeah, it's an attestation, but lower cost than other certifications that may be out there. And if it's done correctly, it's done well done. Um, Take a peek at those SOC 2 reports, though. Again, do you have requirements as a result of that? Are there any exceptions out there we need to be worried about? Is it a type 1 report or is it a type 2 report, right? A type 1 report doesn't really show us much. There's a great show of good faith for continuation, but it's just controls that are designed for a single point in time. It could very much is just a policy exercise, if we're being honest. Type 2 reports provide us controls evaluated over a period of time, right? which provides us, hey, all right, they're actually operating effectively. We know what's going on. But when was that type 2 report provided? Was it last year? Maybe it's out of date by 6 months or even a year now. How recent is that report? Um, just because a vendor has a SOC 2 report, again, I can't stress enough, doesn't mean that they're secure. It is a good foundation to know that they're trying to do the right things. Please review the number of controls and the scope of the controls tested. Does that make sense with the risk that you have assessed them on, right? Should they have more controls in place? Do they have the right number of controls? It's not a number exercise. If they have 500 controls in place, it still doesn't mean they're secure, right? But it does help kind of prevent that mindset of maybe we need to dig into this a little bit deeper. Again, look at those exceptions. Has it is it a qualified opinion? Have they not met those controls that they say that they're doing? Again, SOC 2 is a company's designing their own controls and saying we're going to do this. Are they actually doing those controls? Um, it should inform your decisions as a whole. It's not the whole picture, right? It's a good piece of the puzzle and a helpful tool for us, but it's not the end all be all. ISO, this is more on the international stage, right? It mandates numerous controls that have a statement of applicability that has a more structured control set. You don't have to use that statement of applicability, but you absolutely can, right? It provides a more centralized and more comparable type of certification than what a SOC 2 may be. Again, because everyone's operating under the same scope, or not the same scope, but the same type of control set, same ambiguity, same type of reliance that you need to have there. Slightly different than SOC 2, obviously. Again, it's SOC 2 is an attestation, ISO is a certification. Um, and I will also say there are a couple of stages to it. It is just a more strenuous audit, right, as a whole. I won't dive too farther deep into ISO, just in the interest of making sure we have enough time. It's updated periodically, though. They had the brand new version, which is 2022 version, right? The prior one was 2013. So it gets updated, but how often is it really being updated, right? It's something to consider as well. Take that certification, but always ask for that statement of applicability as well from your vendor. Same thing as a SOC 2. Let's make sure they actually have the right controls in place. Do these controls make sense? It is more strenuous than a SOC 2, but there are still ways that we can have controls not actually apply to what we're doing here. So definitely something to look into, but does provide a little bit more oomph behind its name versus just a SOC 2 report. And finally, high trust, which I'm sure most of you guys know in this world because it's up and coming very quickly, as we know, right? High trust is what I specialize in selfishly. I have to call it the gold standard if you would, but it truly is the gold standard. It has a comprehensive and threat adaptive standard. It's not like ISO or HIPAA or SOC that gets updated periodically. It's updated quarterly at the very least, right? And even more frequently. It keeps pace with emerging threats, such as AI. They just released a new certification for that. It is again a certification as well. And this takes out the auditor's opinion from it quite a bit as well. High trust is ultimately the person or the organization certifying a company. It's not BARR advisory, it's not KPMG, it's not whoever, like it would be for ISO or providing an opinion for a SOC 2. This all goes to high trust, which really helps out with third-party risk management because you truly are looking at one standard across all these vendors that may be out there and you're able to really compare and contrast, hey, how are we meeting this? How are we missing this mark here? It reduces that guesswork quite a bit in assessing security posture, and it really helps you identify vendors if they have a core, hygiene or mature risk control process because you're able to actually take that step further and say, hey, where do you rank against other people in your industry, right? There are three levels to high trust to keep in mind. There's an E1, it's about 44 controls, an I1, which is 182 controls, and R2, which is the best bang for your buck in the vendor management space, is truly a risk-based certification. You spin in a bunch of control factors and outputs a number of controls that is specific to your environment so that you can ensure that you're meeting the right environment, providing that trust to your customers, aka you guys, as an organization or potential vendor of each one of those. So all in all, and what I'll get into here is kind of the pros and cons of each. And I'll throw them all out here. So again, HIPAA pros, you're required to meet it in the healthcare space. There's no two ways about it. It promotes that baseline security culture among vendors. Cons, it's only limited to healthcare, right? It's not as industry agnostic, so it's a little bit harder to force an organization to do who is just trying to break into the healthcare space. It doesn't mandate a specific control framework and mandates requirements, right? So controls can be anything as long as they align to the requirements. Outdated requirements, again, the updates that are being made just right now are, I would still say, 5 years behind where they need to be, truthfully. And again, you can have varying interpretations of what those requirements are actually saying, especially with it right now being required versus addressable. It can create inconsistencies in just having a HIPAA risk assessment or HIPAA report, right? SOC 2, CPA attestation, right? CPAs have to go through pretty good rigor to have their accreditation to perform a SOC 2. And it also helps with providing that detailed report that's flexible to the organization's needs. So you can really risk rank them and understand, hey, what is the organization that we're using? What is the product that we have in scope? And how are they providing controls in that? And do those controls make sense? Again, cons, not all SOC 2 reports are equally created. There are reports out there that are really, really bad. I'll be very blunt about it and straightforward about it. There are other reports that are really, really good. It is incredibly important to look through that. Um, and that's that. For ISO, right? Again, internationally recognized, it's rigorous, and there are surveillance audits that year two and year three you have to review as well. You do still need to look at those nonconformities. You can get a ISO certification with major nonconformities in play. And it is also very time intensive for vendors to achieve, and there's infrequent updates made to it. And then finally, again, the pros list is pretty long here, but there are some cons to high trust as well, right? But the pros are there are multiple control mappings to various frameworks out there. So you can say, hey, this is how I'm showing compliance against all these industries. There are frequent updates. It easily maps to other frameworks, as I said, supports guided remediation. One of the cons to high trust is it is expensive. It is an expensive framework to obtain, but with expensive frameworks comes higher trust. And they actually just released a recent study that had it was a 464% ROI on high trust for what actually it opened up for new business for them. So something to consider there as well. Again, let's talk about vendor AI or AI. Everybody's using AI these days. It's important to ask that question. If you're going to follow the same process that we already talked about with the due diligence, how are they using it? What are they doing? But how are they managing those risks? Are they actually using AI out there, or are they just saying they do because it's everyone's new favorite marketing strategy? If they are using AI, is it their homegrown, internally built AI platform, or are they using an open source platform? Is your data or customer or patient EPHI going into that platform and into AI? We need to really nail that down before we start working with them. How are they training their team around that? How do you as an organization have control of where your information goes within that AI? It's all about transparency, as we showed a little slides or a couple slides back, right? Build that partnership, have that strong relationship to have transparency in this process so you can have those open and honest conversations about that. And if they do have AI and it truly is a core product offering for them, how are they, controlling that? There are various frameworks out there. There's the NIST AI RMS or Risk Management Framework 1.0 that is just really helping think about it, and very similar to HITRUST has an AI risk management framework as well to really help nail down how we think about AI. ISO 42001 is another great offering as well. They have it's all about AI management or the management of AI, right? Not necessarily the security of it, but how are we managing AI to make sure, it's meeting the requirements, it's being used ethically, and what have you there. And then HITRUST also has their own AI security certification that you can tackle onto one of those HITRUST levels. At the end of the day, right, your due diligence is your defense in these processes, right? If the further you're able to go and the further reasonable assurance you're able to gather from your vendors that they're doing what needs to be done, you're really doing as much as you possibly can be doing to get these vendors into a risk appetite that's warranted and relevant for you all. Um, Having these additional frameworks such as NIST or ISO or High Trust or even SOC 2 helps verify vendors' claims about their security posture. They're no longer just saying, yeah, we're doing it. They're actually have having something to back that up as well. Awesome. So let's talk about vendor incident response. Again, as we've talked about, right, vendor breaches can happen and could be a huge issue for us here. Incidents are inevitable in this day and age, right? How are we working with our vendors to contain a breach quickly? Get your security systems back online. You have backup plans in place. And who's actually having those conversations with the people that are being affected by this? This is really what separates a resilient organization from a very reactive one and can really help reduce the cost and the overall burden of a breach if we do this the right way and think about this the right way. And that includes working with everybody here. So how do we even building an incident response plan when we want to have a vendor in scope, right? Well, it kind of has to go along the same place of what's it matter to build an incident response plan in us internally, right? Who's on the team? Who needs to know about this breach? Who has these responsibilities? What systems could be affected, right? This is more of an internal inventory of your vendors and your systems of who's touching what and how fast could something spread. Or how fast could you recover if a key vendor is hit, right? If a ransomware attacks on AWS and it's only hitting one region, do you have a backup region in place? That's one example, right? Again, internal breaches, maybe you're going to have some vendor dependencies as well that may delay the incident response. Maybe your AWS S3 bucket had a ransomware attack on it, and you need to work with AWS to get that resolved. Do you have that back and forth in place to talk through that? Um, has that already been thought about? What does that process look like? And it's incredibly important to, again, who are your vendors? What data do they have? What systems may they touch? How are we going to be able to navigate through this? Again, communicating with stakeholders, especially in the healthcare space. Trust is everything that we have in the healthcare space. How are you notifying those stakeholders? Who has that responsibility of notifying the stakeholders after a breach? Is it written out in a contract that it's ultimately on us to notify them as the organization, or is the vendor handling that? Do they have the proper communication channels in place to actually be able to handle that, right? Who's going to be that liaison between the customers, the partners, and the patients, right? This could go downhill very, very rapidly. But how are we doing the right things in place to make sure that we're able to communicate this out and can retain that trust? And, do you know what to say to explain the impact clearly without divulging obviously more information to cause a panic than what we need to? Transparency builds trust and silence erodes that. Again, that's one thing. I think if you want to take anything away from this webinar, take that quote. It's incredibly important, whether it's just general vendor management, you're talking about AI, you're talking about a breach, right? It's all about trust and transparency to make sure everyone's doing the right thing. If there isn't that, you're going to start to question it. You're going to start to not have that trust in place. Awesome. So now we got to actually test it, right? I won't lie, I'm a firefighter when I'm not doing healthcare security consulting. The last thing I want to do is run into a fire and not train for it or test for it. It's the exact same thing with an incident response plan. When an incident is occurring or a breach is occurring, the last thing you want to do is say, well, where's our incident response plan? I haven't looked at that in 5 years. It's incredibly important before a breach to simulate vendor breaches during tabletop exercises. Work with your own team. Do you even know who to talk to if a breach happens at one of your vendors, right? Bring your vendors in, have conversations with them. Most vendors are very open to having tabletop exercises with you. If they're not, that may raise a different red flag, but something to consider as well. And please don't make it just your IT team, right? Your legal team should be included in these tabletops. Your communications teams, your compliance teams, all relevant key stakeholders that if a breach was to actually occur, how are we communicating this out? How are we making sure that everybody needs to be doing what they're doing? If a breach does occur, document everything, right? You want to make sure that's incredibly analytical so that we can recreate what is going on if there was a breach. Run root cause analysis, even if it was a third party, right? You want to make sure that it happened once, we never want this to happen again. And most importantly, caption lessons learned, right? Attackers are very, very good. How do we continue to stay one step ahead of them, or at least as close as we can as them? Keep our plans updated, right? And then you want to build that trust after the breach happens. Again, if that breach happens, you need to make sure that you have the right controls in place to say, hey, this happened, but this is why. Hey, we did everything we could. The investigation shows that. This is a whole new attack vector that's never been seen before. Audits show that you're identifying gaps before a breach occurs, but also demonstrate that you're serious about protecting patient data. And then share opportunities for improvement with leadership and integrate that into a risk strategy, right? And continue to undergo your regular independent audits. And this is both for your own organization, but also your vendors as well. So ultimately, right, you want to create cyber resilience. I can't stress that enough. You're never going to be able to totally eliminate risk. What we need to do is have the readiness to bounce back when breaches happen. You want to start with that strong foundation of security and compliance. Build on that by preparing to respond and recover. Again, test, 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 and update plans. Continuously improve yourself and your vendors to make sure everything is as it needs to be. And if anything material changes, you know what you're doing and you know what to happen. Um, Cyber resilience ensures you're prepared to recover from adverse events and you're not just protecting them. Preventing is one thing, preparing to recover is a whole different animal that could really use some help in this industry here. Again, at the end of the day, here's the bottom line, right? Vendor risk is your risk, and managing that risk requires smart, proactive planning. The stronger your vendor risk management program is, the more resilient your organization will become, especially in the healthcare space, where there is so much interoperability between systems, organizations, partners, patients, and just various key stakeholders as part of that. So with that, I really appreciate all of you taking your time. I'm more than happy to see if there's any questions that I can answer that may not have been covered. But if you'd like to continue that conversation in a moment here, I'll share my information. Feel free to reach out, phone call, email, LinkedIn message, whatever you see fit. More than happy to talk through, your organization and maybe your specific challenges as well. But again, really appreciate everyone's time here today and more than happy to stay on for a couple more minutes here if anybody has any questions that they might want answered.
You so much, Steve. So yes, the Q&A feature down at the bottom of the webinar link in Zoom, you can use that to ask any questions that were not answered as a part of today's presentation. And then again, the survey that will be sent out after the end of this webinar will also include a section in case you think of something after today. Feel free to put that in. But Steve, I'll give everyone a couple minutes here. We have 3 minutes left till 1. So in case any last minute questions come in. While anyone is typing any questions, I'll also just do my last housekeeping of the day. So thank you everyone for joining today's webinar, brought to you by New England HIMSS premier sponsor BARR Advisory, presented by Steve Ryan. And again, be on the lookout for the survey regarding today's webinar, as well as an email with instructions, again, to claim your CP HIMSS credits. We will also be posting a recording of today's webinar to our New England HIMSS YouTube channel, and then we'll post that link to all of our socials as well. And lastly, if you'd like the slide deck from today's webinar, please feel free to reach out to Steve directly. And we'll be on for the next minute or so in case any questions come up. But thank you all again so much.